Durri Medical Service was established in 1979 in response to the community's needs to have access to primary health care. It just wasn't happening locally. The availability of appropriate healthcare for Aboriginal people wasn't a priority for the other health systems that existed. It's a community-controlled organisation, so the board is actually picked from the community, by the community, every year in an annual general meeting. The organisation is multi-million dollar. We provide services from primary healthcare, general practice, through to specialist services. Aboriginal people can access the services here or through our mobile outreach services that we provide. In total, there's probably about 110 staff across a number of geographical locations, not only here in Kempsey but the Nambucca Valley as well, and over to Port Macquarie. So our area is quite large. I started here in the organisation that I currently manage as an Aboriginal health worker. I was given the opportunities to go to TAFE, and from that I started to have a bit of a passion and a hunger to become a lot more qualified than what I was at that stage. I then saw an opportunity for nursing at a Certificate 4 level, also with TAFE, and I spoke to my employer at that time, and he said, "I need you to go away and do this, and if that means that I get to keep you." So I went away, done that course for that whole year, trained at a local hospital, did what needed to be done. Then I came back and shared that skill set here back in my communities. I then left my employer here in my quest for further on the job sort of experiences, and was able to travel to Bega down on the south coast, and nurse down there at the local hospital for a while tracing my family tree as well. So there was some other motives that were there for that experience that supported that, and that was my quest to find the rest of my family tree and to meet all my other family from down the south coast. I then took up an opportunity to do some rural and remote area nursing then at a place called Narrabri in New South Wales, that then took me on to a Certificate 4 in community nursing audiometry. So I became a community audiometrist then. That then gave me some opportunities to move on to Armidale as an Aboriginal health worker and audiometrist there. It was at that time that I was given an opportunity to undertake a graduate diploma course, and over 2 years with the University of New England, and we successfully completed that course. Chronic disease has been the focus now for the last couple of years. When I talk about chronic disease, I talk about renal disease, talk about heart disease, in terms of diabetes. It's very important, more so now than ever, that our health workforce has the capacity to respond to chronic disease in that sense. That does require a higher understanding of how those diseases actually impact and they actually mix together. The community services and health training package has a very high level of flexibility about the way that it's delivered. You can go and do the short courses, the units that are in there. You can do the whole course if that's what you want to do. I think that it's important for people more so now than ever to realise that the flexibility is there, that the time commitment can be drawn out over a period of time as well, with support from the registered training organisations that are there, who are usually Aboriginal people as well. So, they've studied themselves and they understand and appreciate the difficulties of judging the the timely events such as, family and community service needs and juggling all that sort of stuff, as well as your work commitments. So I think that's important. I guess that where I live here on the beautiful mid-north coast of New South Wales, we're blessed to have a local Aboriginal registered training organisation in Brisbane College. The localisation of that means that my workers don't have to travel great distances, don't have to go through separation anxiety from their families. I also, I think, that the availability of the community services and health training package, but the availability of the Aboriginal health professionals to deliver that as well. They're used as assessors as part of the process. They're used, as people that are writing the curriculum now. So we've even got Aboriginal people that are technical writers as part of this health package, and I think that's probably the biggest part of it, the inclusion of Aboriginal people in the training program. So it's written by Aboriginal people for Aboriginal people, and I think that's a bonus because there's just that cultural competence that seems to go with the package as well. I was one of the people that was very shy of training. I've now turned full circle, and I now become a voice for training for Aboriginal people. I'm not really too fussed whether it's just health. I think it's important for Aboriginal people to be in the face of and have the opportunity to share learning experiences with the general community. I think that education has been a significant part of where I am. I don't think that I would have got the recognition in the non-Aboriginal community, workforces or eyes, had I not had a qualification framework that supported what I said. A lot of times, just in Australian society, we have Aboriginal people that sit around the table and talk with non-Aboriginal people about agendas, about government directions and all that sort of stuff. And in the past, it was always they only sat there as Aboriginal people with the qualification as an Aboriginal person. Now they sit at the table with the same qualification, usually a tertiary one, as the person that they're talking to, but they also hold an ace up their sleeve that they've also got the Aboriginal qualification, and that's something that the other person doesn't actually have. So I feel that from my journey, that it's, as I said, it's not finished with yet. Education is a big part of that.